One in three is quite a large number, and it is, I think, still not fairly well known, at least in the Indian context, right? So, how would one know whether they have DR or diastasis recti? What should be something that they would do to check first? Probably, themselves at home, and then, of course, with a practitioner or physician.
Yeah. So the important thing is around 6 weeks of postpartum, they can do a self-assessment, which may not be very accurate, but yeah, it is very doable. So what a woman does is she lies on her back with the knees bent, and then she tries to do a crunch, the way that you do a crunch with one hand, and the other hand she keeps widthwise, which is like this, like this, in between her umbilicus. If she sees a gap of more than 2 fingers, okay, at the umbilicus, or plus minus 3 inches above and below the umbilicus, that means she is positive for a diastasis recti. So that is a self-assessment. Now there's another way where any exercise that a person is doing which is increasing intra-abdominal pressure. So when I say intra-abdominal pressure, that means any exercise that involves weightlifting, that involves abdominal crunches, that involves either planks. If they are doing so, they will see a tenting. Basically, the part of abdominal muscle will become like this. It will like become conical, tenting. So this is when they are also positive for diastasis recti. So if you have seen some women, especially the old age women, when they cough, the entire belly comes out, right? So they have huge, major diastasis recti. So it is not just aesthetically, important to take care of a diastasis recti, but what it does is it is a part of, so the entire core muscle is the abdominal muscles, the lower back muscle, and the pelvic floor muscle. It is keeping all the internal organs inside safe. And then if someone has major diastasis recti, so what happens is they may have constipation, they may have continuous back pain, bladder or incontinence, or I would say pubic pain or pelvic floor issues. And the worst part is they can also have something called as umbilical hernia, where the internal organs are coming from the umbilical side. So this is very important to understand, not because, of course a woman wants to look sexy and nice and aesthetically good, but also it's important to take care because this can lead to difficult issues later on in their life.